Hi, everybody. Good evening, and thanks for joining us on the WPTV Facebook page. Tonight, we're going to have a conversation about the new emergency rule from Florida's new Surgeon General. You may have heard about this just a couple of days ago. It's once again putting control in parents' hands. This is an emergency rule, again, from the new Surgeon General. It allows any student exposed to COVID-19 to attend school and school-sponsored activities without any restrictions as long as they remain asymptomatic. Students who are showing symptoms, they do need to stay home and quarantine, but this is a change of what has been in the past month or so, 2 months or so, rules that have been in place regarding quarantining. It comes as all of the area school districts in our 5-county viewing area are saying that the high number of healthy students that have been quarantined has really been one of the biggest challenges of the year when it comes to learning loss and simply not having these students in school. Parents, by the way, they do have an option to also keep their child home and quarantine for 7 days, but they do not have to if their child is asymptomatic. We want to dig into this a little bit, take some questions from you, answer any questions you have with our expert that's joining us right now. I'd like you to meet Dr. Lily Wiedrich, is a pediatrician and associate program director at Palms West Children's Hospital Pediatric Residency Program. Doctor, thanks so much for extending your day and speaking with us tonight. We appreciate your time.
Of course, this is an extremely important issue, Kelly. Thank you for having me.
Let's begin with your opinion as a doctor, but also as a mother.
So I have to be honest, when I first heard about the emergency rule, I was extremely surprised. Nothing about this virus has changed as far as how transmissible it is, which means, how contagious it is. The numbers, of course, are going down a little bit because more people are getting immunity, whether it's from the vaccine or whether it's from the illness itself. But we're so close to having the approval of the vaccine for the kids, or, the emergency use order for kids ages 5 to 11. So I was very surprised not only by the new rule, but by the timing of the rule. And, as a mom, of course, I understand very clearly the need and the want to have our kids in school as much as possible. I myself have 5 children, 3 of which we gained from my sister a couple of years ago. And 2 of them do have big learning gaps, one especially. And so, and actually both of them have already spent about 20 days out so far since the start of the school year, whether it was from them being quarantined or, somebody else in the house being quarantined, so they had to stay home because, of course, they're not vaccinated because they're too young. So while I understand the parents' frustration, and while I've also had struggles with obtaining childcare, to me, the risk of them transmitting it to other people or of them catching it and getting very sick and ending up in the hospital, the risk doesn't outweigh the benefit.
And that, in fact, is what one of the school board members for Palm Beach County who did approve the emergency rule, Dr. Deborah Robinson, spoke out. We interviewed her today and had on our newscast, and she said that she did not think it was good public health. She would not support it. She said it's not the way to solve learning loss, which is definitely a real problem, but not the way to solve it. She said, Dr. Robinson said it was bad public health to ignore the fact that someone's been exposed and potentially might get others sick. Now, on the other side of that, though, also talked to parents, and many of them were just concerned because their healthy children were ending up missing out on their education because of the strict rules that the districts had in place regarding quarantining and how many days. It was kind of a complicated 3-tiered thing anyway about, however many days you had to be out of school, when you could come back, when it was after the last date of contact with the person who could have been infected, all that sort of thing. So anyway, wipe that away. This is the rule right now. And I can understand how people would be. Some people might be on the fence on this. That's for sure. We want to hear from you out in the Facebook world and see what you're thinking. But, let's talk about children in general how, as you know, as little people, how are they more contagious, less contagious? Is there more of a risk? You hear a lot of information out there these days. Set it straight about children and COVID, getting COVID and spreading COVID.
So the issue with children is, although the severity of illness may not be as severe as it is with an adult, they are just as contagious, and many times they might not have any symptoms and still be transmitting the virus to others. We know that with this virus, you can start spreading it for 2 to 3 days before you have any symptoms. And some kids have no symptoms whatsoever. We end up in the beginning, we had to test them because the school board was requiring that they be tested in order to go back. And a lot of these asymptomatic kids came back positive. Now, parents might see that as, it's an unnecessary testing because they were positive and they were fine. But it just shows us that if you don't have it, you can be spreading it unknowingly to people, and it could be causing issues for others, for parents, for grandchildren. We've had a number of grandparents in the practice hospitalized or passing away. We've had parents of the kids in our practice pass away from this virus. And, I want people to think about, if your child was exposed, so let's say that your child was with 3 other children at lunchtime, which means they had their mask down or they didn't have their mask, and they were around these 3 other children, and you get the call that they were exposed. So that means that all the kids that were around that one child that tested positive for COVID were exposed. Even if your child didn't get the illness, if you're sending them back to school with those other kids who were exposed and could have the illness and now be transmitting it to your child without any symptoms, it is still putting your child at risk. And to be honest, we don't know which kids are going to do poorly with COVID. Yes, there are ones that are more at risk. There's lots of risk factors that we know about, but there are some kids who have 0 risk factors and do extremely poorly with this virus.
We have a question from Liliana Kana, and a good one. If students wear their masks to school, will they be protected? So will that kind of make up for that, like what you're talking about?
It does protect them much more. What we know about the masks is if a child gets COVID from another child and both children were wearing their masks, the severity of the illness is much lower. So the viral load is going to be much lower, which means the child's going to get much less sick. It doesn't protect your child 100%. They can still get COVID even if them and another child are wearing a mask. But if they do get it, so the chances of them getting it are less. And if they do get it, it decreases the severity of the illness. But it doesn't prevent COVID 100%. No.
We have another question. Kai Jackson is asking, what should I do if my child has symptoms of coronavirus and I don't have a primary care physician?
So there are lots of testing places where you can go. If your child is getting very ill, if they're having symptoms of respiratory distress or they're getting very dehydrated, their activity level is extremely decreased even when they don't have a fever, you can go to the emergency room. The emergency room is not allowed to deny anybody care, but ideally we do encourage you to try to get a primary care physician. In our office, we accept self-pay patients all the time, and I'm pretty sure most offices do. It's just really good for you to have a primary care physician, not just for those times when your child is ill, but to make sure that their growth and their development and everything else is on track. But if you really don't have anybody, again, there's urgent care centers, there's lots of testing sites. And if you need more information about those, we do have some of that information available on our website.
Is the water getting a little muddied because of the increase in, say, colds now that all of these little incubators are back together again in school? Don't common cold symptoms kind of look like COVID symptoms?
Frustrating thing is, my own 10-year-old and 5-year-old have been tested, I want to say about 25 times since this started a year and a half ago. They hate the swab. But every time they have a sniffle, to be honest, I want to know for sure if they have COVID. Now, I'm not saying, that you have to go get your child tested. You can do the quarantine and protect, other people around you. But it's very frustrating because it's the same symptoms. And the CDC is recommending that if your child has any symptoms of COVID, that they should be tested for it.
We have a question coming in from a colleague, a doctor, from one doctor to another. He's not in pediatrics. Are you seeing hospitalizations? And what about the severity? So the hospitalizations of children with COVID.
Unfortunately, we are seeing hospitalizations. In our own practice, the numbers have been very low, but because I'm the associate program director of the pediatric residents, I hear about all the cases over there. We have only, don't quote me 100%, but I believe we've only had one child pass away from COVID, and there have been quite a few kids admitted to the ICU. A lot of those were kids with more of the risk factors, but there have been some admitted that didn't have any risk factors at all. Oh, and the severity of the illness is much less in the kids that have been vaccinated, of course.
Right, exactly. But of course, there's still that group which can't be vaccinated yet. The young ones, that's for sure. We have another question coming in from Janine Beeler, I think. Why is it okay for asymptomatic or pre-symptomatic students to remain in school? I thought they were still contagious.
So Janine, you are 100% correct. They are still contagious. And we in our practice are going to continue to recommend that kids do stay home until, there's the CDC guidelines of either getting them tested day 5, 6, or 7 after exposure, and then they can go back after day 7. And the transmission rate at that point is about 7%. So they can still transmit it to other kids, but it's about 7%. Or if they wait the entire 10 days, the transmission rate goes down to about 1%. Now day 5, 6, and 7, remember those kids have to get tested on day 5, 6, or 7. And also if they develop symptoms after that, they do still need to get tested.
And Julie's writing in, are pediatric symptoms still respiratory, or are you seeing a lot of GI symptoms?
GI symptoms are part of COVID, and you can have only GI symptoms and have COVID. And with GI symptoms, you also have to be concerned for the inflammatory syndrome that kids get, the MIS-C. With that.
Do they, when you compare adults to children and their symptoms, are they exactly the same?
So since I don't see a ton of grownups, our practice goes all the way up until 21 years of age. Mm-hmm. But the symptoms are pretty much the same. It's just that typically, I'd say on average, kids tend to be a little bit, have milder symptoms than the adults. Mm-hmm.
So with this emergency rule, it's in the parents' hands really to decide if their child is asymptomatic. Again, for those of you just joining us, a new rule by Florida's new Surgeon General that if your child's been exposed to COVID, but they're asymptomatic, they're allowed to be back in school. They do not have to quarantine. It's up to the parents. But parents also have the option to quarantine their child if they're worried about it. So it's really going to come down, I think, to what the parent is going to choose in that particular case.
Right. And I do like the fact that they're not going to be penalizing any parents for keeping their kids home for the 7 days. I'm glad that there's that option available still.
Yeah, Jillian's also writing in. Let's see Jillian's question here. What are your thoughts, doctor, on children getting the COVID shot?
So initially, like I said before, I have 5 kids. Their ages 5, 10, 2 13-year-olds, and a 15-year-old. And I'm not going to lie, as a mom, it is scary because this is something that's new. So when the vaccine did first come out, there was a little bit of that fear, am I doing something that could possibly harm my child? But when I looked at the data and the side effect profile of the vaccine, in the end, I felt like it was such a higher benefit to getting the vaccine than the risk, because the side effects from the vaccine, even the kids that do have them, are very short-lived, very easily treatable, versus COVID that, could cause severe harm to your child, or give them that, long haul syndrome.
Exactly. The unknowns, I think, are so scary about COVID in general, is just not long term.
Right. So sorry, Kelly. So as far as the, the younger kids, the 5 to 11-year-olds, we're hoping that gets approved within the next couple of weeks. Once that gets approved, of course, I'm going to be looking at the side effect profile very closely and kind of weighing, the risk versus benefit ratio so that we can decide what to recommend to kids in our practice. Right now, we are recommending that all kids 12 and up get the vaccine, and my 3 older kids got it. I want to say it was within the first week or two that the vaccine became available for them.
And COVID, and it spread among children, simply the coughing, the talking, anything, it spread through the air, right? So is that how
Right.
kids are spreading it too?
Yes. Yes,
Mhm.
exactly.
All right. So same way. We did have a question. It popped up, but it went away. Let's see. Okay, here we go. Kristen saying, I'm wondering if I should remove my children from public school for safety. What do you think?
So, of course, when it comes to these types of questions, there's no one size fits all answer. It depends on your children. Are they ones that would do well with homeschooling? Do you have the resources to be able to homeschool them? Do they are they ones that if they stay home and they're not around their friends that they're going to get extremely depressed? So there's so many different factors. Me personally, if I were able to pull my kids out of school temporarily for the next couple of weeks, I probably would until that vaccine becomes available.
That it's going to be, yep. I mean, so much on parents right now, that's for sure. And these are decisions that are going to be individual and family to family for sure. Let's see. I don't really understand that one, Jackson. So let's see.
I think they're saying it's flu season.
Okay. Oh, I've gotcha.
That's
Good one. Good. You jumped on that right away. It is flu season. So that is what, like we were talking about a little while ago with the common cold, that sort of thing. I mean, they're going to mask. These symptoms are going to be similar. So it is going to be hard to determine. And that's why you were saying testing is certainly something that should be done to rule it out.
Yes, and to be honest, both illnesses, can be very severe and can be deadly. This is one of the reasons that we are urging parents even more to get the flu vaccine for their kids so that we don't have to worry as much about the flu on top of COVID. But yeah, many of the symptoms are the same. The big take home that I want parents to get out of this is, if you aren't able to get your child tested for whatever reason, if you're just going to quarantine them for the 10 days, please just be aware of the symptoms of severe illness. And again, you can get this from the flu. You can get myocarditis from the flu or any other virus. So, again, if your child's activity level is extremely low, extremely abnormal, even when they don't have a fever, or if they're breathing very quickly, they seem to be having shortness of breath, those are things that you definitely need to seek care for. And also if they're very dehydrated. So if they're, not able to urinate, well, it depends on the ages, but if they're not urinating as much as they normally are and they're extremely tired.
Jillian has another good question. If a child already had COVID, do they need to get the COVID shot, or are their antibodies enough?
So again, because all of this is very unknown, we don't know for sure. The current recommendation is to also get the vaccine, even if you've had the illness. We believe that people who have had the illness are more immune for about 90 days. So, if you wanted to wait till the end of that, but the recommendations are to just get the vaccine as soon as possible and protect yourself as much as possible.
So if a parent comes to you, Dr. Wiedrich, and says, my child is asymptomatic, but they've been exposed, or let's just say with this, they've been exposed. What do you tell them to do? Keep them home, or send them until they show a symptom?
For me, I would keep my child home. Again, like I said before, even if your child isn't having any symptoms and they didn't get it from that child who tested positive, when you're sending them back to school, that means that all the other children, the children that they normally sit next to were probably also exposed. If that child that was exposed next to them now has it, now they can give it to your child. So it's just, for me, I would say keep them home for at least 7 days. And it's not 7 business days, it's, 7 days. So, they may end up missing 5 days of school, unfortunately. But for me, the benefit to keeping your child home versus the risk of them getting COVID, being very sick, going to the ICU, giving it to you, giving it to their grandparents, the benefit of keeping them home far outweighs that risk.
Are you seeing any trends in a positive direction? I know the Florida Hospital Association, I think it was at the beginning of the week, came out saying that hospitalizations in the state of Florida were trending down. How are you feeling about where we are right now in the pandemic and being able to, regain more normalcy in life?
So, the trends, the numbers are going down as far as illnesses, hospitalizations, deaths. but I'm concerned that if we start being more lenient now, as far as the quarantining, everything's going to go right back up. So we're going to have, more sick kids with COVID again. Of course, there is that little bit of herd immunity, because we have people that have had COVID and we have a lot of people that have had the vaccine. So, those numbers are going down a little bit, but I just don't want us to get complacent and then the numbers start going back up.
Exactly. No doubt about that. In our remaining minute or so here, Doctor, give us the best advice, which I'm sure you dish it out every single day to the families you see in your office. But what is the best advice concerning children and COVID and prevention of COVID?
So the best protection is to do basically all the things that the scientists have been recommending. So, hand washing, wearing the mask if they're going to be out in public places or at school. If your child is old enough to get the vaccine and there aren't any contraindications to that, get them the vaccine. Pretty much all the recommendations from that have science behind it.
Right. And in general, since you see children every day and treat them every day, not just the ones that have had COVID, but how do you think our young people are faring, through all of this? I mean, certainly we've not lived through a pandemic in our lifetimes, and they're getting it at a much early age. How do you think mentally they're handling living through all this?
Unfortunately, it hasn't been easy. We see a lot of kids with increased anxiety and depression and, slight social delays, meaning the sense that they just have more anxiety now that they're back out in social situations. So it hasn't been easy, but the good thing is that there are a lot more resources now than there were before. So, for example, even just telemedicine now has made it much easier for kids to access things like counseling. Again, none of this has been easy. My own kids have been struggling, especially the ones with the learning gaps. But kids are extremely resilient. And, I think that this is something that in the long run, hopefully when this pandemic ends, in the long run, we're going to look back and we're going to be surprised and amazed by how well the children did.
Oh, I know you're right, and I'm hoping every word of that is absolutely true. Hope we can all get through this one day very soon. We've got to keep doing what the experts are saying in order to kind of keep this at bay. Dr. Wiedrich, is there anything else you'd like to say to anybody watching? Any advice at all?
No, I think we've covered quite a bit.
Yes.
Thank you, Kelly.
Well, I really appreciate your time, Dr. Lily Wiedrich, a pediatrician, also at the Children's Hospital out at Palms West Hospital, the director there of the residency program. We really appreciate your time. I know you're probably exhausted. I know you've had a long day, so thanks again, and stay safe, everybody. Thank you at home for watching.
Thank you so much. Stay safe.
You too.